Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everyone. Good morning. Good morning. Today is Tuesday, December 21st, 2021. First, let me say happy birthday to my aunt, Conchetta Johnson, because she would get me later. Happy birthday to you. Listen, we're going to jump right in. I don't have time today. As you know, we do every other Tuesday, sponsored by the Massachusetts General Hospital Office of Equity and Community Health in partnership. They are a sponsor of this segment here, Your Healthy Java. And there is a lot going on in the realm of COVID-19. We just found out that some of the stats are showing that 73% of the new cases are being attributed to the Omicron variant. And so it's just important. I'm going to cut to the chase. We're here to talk about the vaccination and specifically to talk about it as it relates to its approval for children ages 5 and up. I would like to state the disclaimer that your child, you are not examined by the physicians that are in the room this morning. And so they are giving general answers to questions that you will be able to ask toward the middle of this broadcast today. But without further ado, I would like to bring my, I call him my co-host, but I would like to bring Dr. Alabre into the room, and then we're going to introduce our guest who are here with us this afternoon. We are honored to have a pediatrician from the Massachusetts General Hospital and also Dr. Sanchez, who is the director of the Infectious Diseases Bureau at the City of Boston's Public Health Commission. And we'll touch a little bit on what Mayor Wu mentioned yesterday. But do me a favor. I ask this generally sometimes, but this is a very, I'll just go ahead and say it, strong brew, hot topic around getting our children vaccinated. And so it's very important that you take a second and hit that share button, hit the retweet button if you're watching on Twitter or on YouTube, copy the link and put it on your social media network. But I'm going to bring in Dr. Alabre and he's going to greet you and then we will introduce our guests. Remember that you will have the ability to ask questions in just a few moments. But Dr. Alabre, good morning. How are you? Good to see you.
I'm doing well. Thank you. How are you?
I am doing pretty well. As many in the community know, we had a very significant loss in our community, and I'm dealing with that. But thank you so much for asking. And Dr. Labre, we thought, we kind of plan out a couple of weeks in advance topics that we're going to discuss based on what the community is telling us. And you've mentioned this before, but how important is this topic today, Dr. Labre?
It's very important, obviously, and we're learning more and more every day. And we've known for a long time this is one of the best tools we have to fight this pandemic. And we want to hear what people have for questions, concerns, and we have a good crew today. We are very excited to have the experts in the room, both the pediatrician and infectious disease specialist. So I'm hoping to be able to get the people to get the conversation going. I'll be more in the backseat today.
Absolutely. Sometimes it's always good to be in the back seat, pushing and quote unquote driving. And so I'm going to ask our guests to introduce themselves. And Dr. Labre knows this, and forgive me for not asking you, but you all are in this. You all are seeing children, adults. Dr. Sanchez, you are now on a policy level and influencing how we address this on a municipal level there at the Health Commission. So I want to ask both of you as just regular human beings, after you introduce yourself, if you could end with your current mental health status by using one word, just one word, and you can give us some context about it. But Dr. Sanchez, if you would introduce yourself and give us your one word first, and then we're going to talk to Dr. James as well.
Good morning, everyone. I'd say my first word is gratitude, and sort of a day by day. I'm Dr. Sanchez. I'm an infectious disease doctor. I work at Mass General, and I'm also the director of the Infectious Disease Bureau at the Boston Public Health Commission. Thank you for having me here.
Thank you so much, Dr. Sanchez, and juggling between patients and also this municipal responsibility. We definitely appreciate you sacrificing your time. Dr. James, if you could introduce yourself as well. Not a stranger. It's been about a year you were with us, and we were actually talking about COVID-19. I don't think we were talking too much about the vaccination at the time, but it's been about a year. So welcome back.
Thank you so much. It's great to be back. So my word would be relieved. And that's because my son actually is recovering from an illness. And so I'm very happy that he is finally on the road to getting better. I am a pediatrician. I see both adults and children as a primary care doctor at MGH Everett. And I've also had the opportunity to give many children the vaccine through our vaccine mobile unit.
Thank you so much, Dr. James. And shout out to the Office of Health Equity and of equity and community health. And so two of our guests today, I'm going to jump right in because, you know, I like to be transparent and authentic. These are also physicians, but they are also parents. And so Dr. Labra, you've sort of talked about this before. Did you have your child vaccinated? Are they eligible, and did you have them vaccinated?
Absolutely. So only one is eligible. So again, it's I'm in that phase where I'm grateful that we have this for one of them. I am also cautious because we obviously can't do it for the 4-year-old yet, but still optimistic that, you know, our scientists are working hard, and there's certainly more to come. And someday I think we'll be able to get something for everyone, basically.
Thank you so much for that. And Dr. James, I believe y'all know we talked before we get on. I know, Dr. James, your child is not eligible to get the vaccination. However, you did mention, you know, I believe you said he's dealing with the flu, and you could talk about that.
Yeah, and a good reminder. So my son is 2, so he's not eligible for the vaccine yet, but I am hopeful that it will be available soon because I know that the researchers are looking into its safety and efficacy in younger kids. So my son, I sort of dragged my feet on getting him the flu shot because he had a checkup coming up in January. So I didn't get it for him, but me and my husband both ended up getting it through our jobs. And then this past week, my son just got the flu and actually got pretty sick with it, had to go to the doctors twice, had some trouble breathing, was quite stressful, but it was a good reminder of why we get vaccines. And so definitely a good reminder for me that when the COVID vaccine is available for him, I will be first in line.
Absolutely. Dr. James, I'm going to stick with you for a second, and we'll pull Dr. Sanchez and Dr. Alabre in the convo as well. But as a pediatrician, how important is it that parents give strong consideration and I'll just go ahead and say it, get their child the vaccination? How important? First, let me just back up a little bit. Vaccinations are nothing new. We've said before here, the science behind vaccinations is not new. And so if you could give about 30 seconds just about what vaccinations do, and then how important is it that parents get their children vaccinated?
So vaccines show our bodies a little bit of an infection so that our bodies can make antibodies and immunity to them so that whenever we are exposed to that infection in the real world, we don't get sick. Or if we do get sick, we don't get as sick as we could have, because we already have some immunity. And so it's hugely important. I mean, one of the amazing things about children is that children are very resilient. So it's true that children, like my son right now, are usually very good at recovering from illnesses. Obviously, he was suffering, and so I didn't want that. But we do know that even though the vast majority of children are going to recover, there are still very severe cases of COVID-19 that can happen in children. And there have been, over 600 children who have died from COVID-19 in our country. So while the risk is rare, it's still there. And then the vaccine is a way to help prevent that and to keep your child safe.
Thank you so much for that. And Dr. Sanchez, with where you are, we just acknowledged Dr. Sanchez is still seeing patients, though, with this municipal responsibility. So you're in it on 2 levels. As far from your perspective as an ID, used to move in the medical industry, as an infectious disease doctor, How important is it specifically for COVID-19 that we get our children the vaccination?
It is absolutely critical. And let me say, all of my recommendations are always underscored by first and foremost me being a physician. And I urge everyone 5 years and older to protect themselves by getting fully vaccinated. And that means, parents getting their children vaccinated, getting themselves vaccinated. And then we also recommend that everyone ages 16 and older, and that includes teens and adolescents, that they get boosted. It is absolutely critical with the degree of spread that we're seeing with the Omicron variant, and as we gather with families and friends over the next few weeks. And I also want to take this opportunity to urge parents to get themselves and their children vaccinated against the flu. Dr. James, I'm sorry to hear that your child was sick, and glad to hear they're feeling better. But our children do get sick from the flu, and that's an important reminder to get vaccinated as well.
Thank you so much. And we're going to touch on that because Dr. Alabre, you see adults, and we're here talking about the children. So just for a couple of seconds, adults, can we just reiterate? You said something a couple of weeks ago. You're known for saying, what is your statement? Find healthcare, get it where you can. And then
healthcare matters, get it where you can.
Healthcare matters, get it where you can. And so
Right.
for adults as well, if you could just talk a couple of seconds about the importance. And then Dr. Sanchez, I'm going to come back to you and ask if you could just clarify, because I'm hearing different things about the positivity rate. And Dr. James, I'll come back to you and just see where we are with the vaccinations and what the latest research is saying.
Yeah, I mean, we definitely are at a point where we're seeing a lot more infections, and we're also seeing more breakthroughs. I was just on call this weekend, and I cannot tell you the number of calls that I unfortunately got, and it is sort of sad that we still have people who are hesitant and questioning, and the level of severity is a lot worse, obviously, and the concern is much higher in people who are not vaccinated than it is in people who are vaccinated. We've known this for a while. The data is very clear. And we try our best to make sure people are getting the right information from the right sources. And we understand certainly that there are questions, and we'd like to be able to help people understand the safety and the efficacy of this vaccine, which has been looked at by, again, I've said before, layers and layers of organizations and people and scientists and physicians. And so we do have the data. This is not a question. It works and it is safe. And at the same time, we're also starting to see a lot more breakthrough infections, because we know that the immunity that you get from the first 2 doses of the vaccines, if you got the mRNA versions or the first Johnson & Johnson vaccine, does wane over time. That means you're more likely to have symptoms, breakthrough infections, and have higher severity of illness if you have not gotten boosted. And so we are really, again, encouraging people to get boosted, as Dr. Sanchez just mentioned. And it is not because the vaccine doesn't work. It's just that's how vaccines are. And we do know our immune response can sometimes go a little dormant and needs a little bit boosting to really be on top of things. And we understand that as the variants also change, sometimes one of the things that happens is that they are replicating a lot faster, and you need something to be ready. And I think I like analogies, you guys know that. And so it's sort of like if you get your fire department ready for fire, they know what the fire is, they know how to recognize it, and then they got a little bit, tired and comfortable because there hasn't been one, and they sort of sleeping a little bit. Maybe you just need to wake them up and sort of put them back on guard. And sort of that's the idea behind the boosting. You want your immune system to be ready, and that will certainly reduce the likelihood of the virus taking over, causing illness, severe illnesses, or get you in a hospital and possibly dying.
Dr. Alabre, thank you for that. And so, Dr. Sanchez, and I just want to acknowledge something for those of you that may be looking at the comments in the live, and I know a lot of you interact with them. There are some folks that are not in agreement with the benefit of the vaccination. And so I am doing my best to monitor those comments, and unfortunately, and I don't, not censorship or whatever, but we're here to ensure that accurate information is presented to the community. And let's just also name all four of us here are people of color. So we're talking from a medical perspective. We'll talk about Dr. Sanchez. Dr. Pasola has talked about this a lot. And I saw her on IG yesterday, and her and the mayor kept it 100. I understand the hesitancy, and you can speak to that a little bit if you would like, with the also letting us know where are we with the positivity rate currently based on the data you have. And based on the last MIC report, Medical Intelligence Center report, I saw about a week and a half ago, the numbers are rising and all over. But, you know, when it comes to numbers around vaccination, so a lot there. But if you could just speak a little bit to the validity that Dr. Pasola talks about, and then also let us know where we are in the city.
Of course. So, you know, right now at the city, we look at positivity rates as well as our healthcare metrics, which really give us a sense of how prepared our institutions are, what their capacity is to handle, to be able to care for patients with COVID as well as other patients in the hospital. And so our latest positivity metrics for the city were exceeding our threshold of 5%, and we're at around 6.7%. In addition to that, what most concerns us is that our hospitals are feeling the strain. That is what we're hearing from our colleagues, as well as what we're seeing in the data. But last week, our hospitalization threshold crossed our threshold of 200 COVID-19 hospitalizations per day. And again, this just indicates that there is strain, and that if any of us get sick, it really jeopardizes our doctors, our hospitals' ability to care for us. And that usually leads to more deaths. And so that's really what's worrying us. And in light of the Omicron variant, which we know spreads more quickly than other variants that we've seen, you know, it is really time for us to double down and get vaccinated, get tested, and really protect one another,
Thank you
especially
so
as we gather for the holidays.
And I'm gonna extract a lot the importance around that as well. But if you could just also, as your colleague Dr. Pasola, I call her Dr. B, has talked about named yesterday, just if you could speak a little bit to the hesitancy that a lot of us have, the experience in the healthcare industry. Let's just name that and be. This is an authentic platform. Let's just name that, and then your perspective on that and the importance of, and Dr. Ronke was with us a couple of weeks ago, and it's a health equity perspective. And Dr. James, I'm coming to you right after that to really talk from a pediatric perspective. But Dr. Sanchez, we need to make sure before we get to the pediatric perspective, we need to make sure the adults understand the importance so they can get their PD child, their PD patient vaccinated. So Dr. Sanchez, what Dr. Pasola has mentioned, and I'm sure as a woman of color and coming up in academic, you may be able to, well, yeah, I'm sure you may be able to do some things. Can you talk to the validity of a lot of people of color's concern around vaccination and just dealing with a lot of things in the medical industry?
Of course. I mean, I think that we can all acknowledge that there are many valid concerns that are rooted in many factors, several historical and sort of the political factors that we've seen across this country that, you know, have really that have really required us as the medical field to really gain the trust of our communities. And that's, I think, the perspective that we need to come from. There's also really a lot of challenges around misinformation and really making sure that we as the medical, as the public health experts, that we make information that is culturally sensitive, that is linguistically, available in multiple languages, readily available to our constituents. And we know that that can be a huge gap. And then finally, there's access issues. And we at the city have been committed to working on those, and have lifted up many family clinics over the past weeks and continue to do so, rooted in the communities that need us most and the communities that we know have been disproportionately impacted across the city of Boston. So I think that there are multiple factors at heart here that are very legitimate, and that we, as you say, we need to name and address.
Thank you so much for that. And Dr. James, to you, it's funny because I've heard adults say, hey, I'm not getting it, but my child's in school and children, and some on our side of they're going to get their child the vaccination, but then some have a lot of reservations that have not gotten it, them, or they're not thinking about their child. And so what are the risks? We know children are not exempt from having pre-existing conditions. A lot of children of color deal with diabetes and different things like that. So what are the risks? And if you could talk specifically around children of color and some of the things that, sickle cell, different things like that. What are the risk and then the benefits of getting your child vaccinated against COVID-19?
Absolutely. And I would just like, going off of what Dr. Sanchez has said,
Please do.
it's true that like the healthcare system has treated people of color, has treated Black people and Hispanic and Latinx people poorly, and that we still have a lot to do to treat our people better, just like many other systems, the education system, the criminal justice system. And so that's absolutely true. And so it's harder and it's unfair that like as we're approaching the healthcare system that we're like, we have to trust a system that has treated us poorly. And the only way to actually keep myself safe from COVID-19 is to put trust into this healthcare system. And I think it is important that there's more people of color like myself and Dr. Labre and Dr. Sanchez who are in the field. And so hopefully people can like connect with doctors and nurses that look like them, and so that they can trust them more, so that we can be like, I got the vaccine. My son is going to get the vaccine. I know this is the way to keep myself safe and the people I care about safe and my patients safe. But I just wanted to underscore that it's harder for us because other people, they haven't been mistreated. And so it's easier for them to go up and trust the
Dr.
system.
James, so I'm sorry, and Dr. Labre knows it. One of the other things, someone said something, and I got on this level, and I heard Dr. Labre in the background saying, so, can I just extract something? You said it's harder for us. Dr. Sanchez, the mayor, Dr. Pasola, volunteers, Walgreens, CVS, BCYF, BHA, the availability is there. Dr. Alabre, Healthcare Matters, and do what?
Get it where you can.
Get it where you can.
And when you can, and it is now.
I'm so sorry because it is so,
And that's a good point too. I know adding up to what Dr. Sanchez and Dr. James just said, we know it's important and we know there are questions and concerns and trust, but at the same time, we also don't want to be left behind again. And we've talked about this on this platform before. We have been left behind on so many levels for so many years. And so we don't want this to happen again. We have people now in the field. We have scientists involved. We have Black people on ethics committees. This is not the same time when we were sort of all outside of the room, not being part of the decision, not being part of the science. So we do have reasons to trust this more than we ever did before.
Dr. Labre, you summed it up there. Dr. James, sorry, we got to echo with someone. I might have to mute. I think we fixed it. And so, Dr. James, if you, because I heard you say something about how hard it is, and Dr. Sanchez, after Dr. James, the three of you can just, sort of have a conversation. And so, Dr. James, from a pediatric perspective, I'm gonna ask a little question. What are you seeing right now with maybe around admissions, maybe around positive cases? What is the landscape of our children?
So we're definitely seeing a lot more children getting COVID-19. They're making a larger percentage of the people who have COVID-19. I'm seeing a lot more patients in my office who are, and we're getting patients admitted. While most of the children are doing well, we do have patients that are getting admitted with this multi-inflammatory syndrome, which is a dangerous complication of COVID-19 that makes you very, very sick. And so, again, really just want our children to get vaccinated so that they don't end up having these really serious complications.
Thank you so much for that. And so, Dr. Sanchez, you talked, and I did not, this point did not go beyond us. A couple of months ago, I got some folks that work in healthcare system, and they were like, Jimmy, the positive cases with the vaccination, yes, is still an issue, but the hospitalizations, you talked about that a couple of seconds ago with Dr. James' point of it being harder. There are people, there are things like elective surgeries that may not seem urgent, but still important. I'll be very transparent. I have a family member who was just diagnosed with stage 0 cancer. And I was so afraid that from the proposed mastectomy and whatnot, like, is she going to be delayed in getting treatment? And so can you talk a little bit just about the impact? And this is not a finger pointing of those that have not been vaccinated yet. I want to reiterate that there's an impact beyond you. We're talking about children. Here's your children, but there's a communal impact. We got Kwanzaa coming up, and we talk about, community impact and being more communal. Can you just talk about the importance of getting it from a community perspective, from a perspective of what you talked about with the hospitals?
Sure. I mean, first of all, I'm sorry to hear about your family member. And right. So, broadly speaking, I can say, and when you hear the reasons why many people get vaccinated, it varies. Many people really get vaccinated to protect their own communities, right? Like we get vaccinated to protect ourselves. I mean, we get vaccinated to protect those around us. And in addition to sort of that, like, more like micro effect, like how the people around us, it's also a matter of protecting, as you mentioned, the hospital capacity in the healthcare system around us. Because again, we know that the capacity to provide, beds, staffing, it's limited. While currently hospitals are being asked to delay sort of elective procedures, and every hospital can define that in a certain way, so that I would hope that essential care, like the family that you mentioned, is not delayed, right? I mean that certainly is different. But that being said, again, all of these cases and hospitalizations do put a strain on our healthcare system, and I think we have to acknowledge that. And and we know that most of the people who are hospitalized with COVID, at least 2/3 in Boston, are not fully vaccinated. And I want to acknowledge that a lot of what we're talking about, it's hard. A lot of this is rooted in fear, in very, I think, and that's, I think, what we all have to also name is, when we talk about, not getting vaccinated, the different reasons why people don't get vaccinated. We have to be mindful that there are many people come from different perspectives, and that oftentimes it's a fear of, again, the healthcare system that's often in the past sort of, hurt or, not treated well, sort of people of our communities, or, fear about the vaccines or fear about the pandemic. But really what we're all here together is to address those fears, to really reach our communities and to protect ourselves, one another together. And on the vaccine front, I just want to note that we at the city are focused on making vaccines boosters widely available, and that they are widely available through the city. This past week, we held 2 large-scale clinics at the BCYF Vine Street Center and Melnea Cass Recreational Center. We administered over 800 vaccines and boosters, and we still had vaccines left over. And so we have work ahead of us to really address this fear, and to protect our communities now as we face this surge.
Dr. Sanchez, thank you. And Dr. James, I'm going to come back to you. And you gave us a little perspective. You're seeing more patients. You just mentioned there's more admissions. And so, it's not just the adults that can be impacted by this. It's also, and I asked you a few minutes ago, and you said one thing and got me excited because there was something there that I had to make sure that we pulled out. And so the impact on our pediatric patients, what, if we don't get our children vaccinated on a large scale, what is it? I'm not asking you to doom and gloom. I'm just asking you to say, from your perspective, from your professional perspective, what is the potential of the strain in let's say children's or pediatric departments within other hospitals? What is the potential strain, not just on admissions, but just on our children's bodies? You talked about the inflammatory impact of COVID and whatnot. So if you could just speak for a few minutes of what the downfall is of not getting our children vaccinated.
Absolutely. I think, so I spoke a little bit about the multi-inflammatory syndrome, which is a severe form of COVID-19. But even children that get a mild form of COVID-19, there is a small percentage that can go on to get long COVID, which people may be a little bit more familiar in adults, where people have these ongoing symptoms for weeks and months. And it can be trouble breathing. It can be like their mind isn't working as well. It can be hard for them to work in school and do well in school. And so even with a mild disease, there's risk of having long-term side effects. And we still don't understand why some people are getting this, why some people are not. And it's not that it's only children with underlying conditions, it's happening in healthy children as well. And so these are just risks that we can avoid by having the vaccine. And I think the other just larger risk is, children are amazing and they like to spend time with each other, and they're like okay at wearing masks, but they're not amazing. And so the other risk is that just the numbers are going to really go up, and our children are going to have to go back to virtual school. And we already know that it's had a huge impact on children's, like how they're doing academically, emotionally, speaking with my friends who are teachers, school is just super challenging right now for the teachers, for the children. And so I think we really would be hurting our children, even those who don't get COVID, if we ended up having to close our schools again and go back to virtual.
Dr. James, I'm sorry. You did it again, Jesus. And so we Dr. Labre and Dr. Sanchez, and we talk about the limitations that we deal with people of color. The education system is not perfect. We see the impact of the last couple of years of school. And so the with all that our children deal with inequity in education already, with the pandemic, on top of that, not getting them vaccinated adds another third layer to our children being impacted. And so we know that from what you said, the mental health impact, we're going to be dealing with this almost a generation out. And so again, not doom and gloom. These are just people that are in the medical industry and and I'm sure they've had to take some level of psychiatry and psychology and whatnot and understand. And so this is why we're here today, to talk to you and share information. And also we're getting ready to ask questions. I do see one question in the comments so far from Jen from Boston, and she is asking, good morning. My son is 16 and is vaccinated. Is he old enough to get the booster? First one that raises their hand can answer. Dr. Sanchez.
Yes, he is old enough to get boosted. He can receive a Pfizer booster. So yes, please get a booster. That's very exciting.
Thank you. And go ahead, Dr. Labre.
Yeah, no, I wanted to see if Dr. Sanchez wanted to speak a little bit to this, because I know a lot of the concerns out there now is that people are seeing breakthrough infections and they're thinking, oh, well, the vaccine doesn't work. Why bother anyways? And so we know there's a lot of reasons to, but I'd like to see if Dr. Sanchez, being an infectious disease specialist, wanted to speak to that, because we don't want to discourage people at this point, obviously.
Thank you, Dr. Elaborate. So, I think that we do see breakthrough infections. With no vaccine is perfect, but I want to underscore that we're still seeing protection from severe disease and people getting hospitalized and dying. And again, that really comes back to when we think about protecting ourselves. That's what really. I mean, some of us might get sick and might have a cold or have to stay home, but you'll get through it. But what we're seeing amongst people who aren't vaccinated is that they end up in the hospital and that they die, and that at a much higher rate than people who aren't vaccinated. And so that's really the critical piece here. And I actually really, I really want to thank you for bringing up schools. It is critical for our kids to get vaccinated, for them to stay in school. I've been working with Boston Public Schools to really help advise a lot of their COVID-19 mitigation strategies, and really keeping our kids in school is a public health priority. Our kids have been through so much, and it is critical for their mental health and for their emotional well-being and their future learning. And getting vaccinated is critical to that. So I really just wanted to uplift that and thank you for bringing that up. We have to sort of see in the long term as well what's really at stake here, and that's our kids, our future.
Thank you so much, Dr. James. I'll throw this to you. What about the Moderna for children? I did also hear Dr. Sanchez refer to the Pfizer. Is that because of just, supply and demand, or is that, because of CDC or FDA approval?
So I can start and then Dr. Sanchez can go on. But so right now, the only vaccine that's been approved for children has been the Pfizer vaccine, because their research study had completed. There is a large Moderna study happening right now in children 5 and up. And so likely that will become available, but that's the reason that the Pfizer is available now. And I think it just, again, highlights that we're not just throwing these out willy-nilly, and that we're doing the research and making sure something is safe before it's getting approved and before we ever put anything into our child.
Thank you so much. And Dr. Sanchez?
Yes, I mean, I have nothing to add to that. Yes.
Okay. I'm going to go around and ask you and this one is sort of this is a organic space. Dr. Sanchez, you brought it up, so I'm going to ask you first. The holidays are coming. And Dr. Labre, I think this is where it's hitting me. The CDC and you all as the experts have predicted that there is going to be, I won't attribute to you because I don't want, I want to be fully fair. I don't know if he was part of that study, but it's been predicted by the scientists, Dr. Fauci and them, that with Christmas and New Year's, there is, and we're seeing a surge. It's only December 21st. We're short of 30 days out of what the potential predicted surge is. What would you say to families around gathering around the holidays without the assurance that everyone is vaccinated and or got tested within the 48 hours of their holiday dinner, or presumably, let's say Saturday's dinner? What's the potential impact, Dr. Sanchez?
It's a really hard time. I'm
Mhm.
going to name that. We're seeing a lot of spread with the new Omicron variant, and that really underscores the need for people to get vaccinated. Now, that being said, we at the city have put up guidance around a few things.
Yep.
First of all, I think that again, if you're vaccinated and boosted, again, I want to sort of underscore the importance of boosting. You may get, you might get COVID-19, but for the most part, you will be protected against severe disease and hospitalization and death.
Can you
I
reiterate that for the people in the back, as they say, because there's this misnomer. And you talk about the misinformation. It is not a stopper. It is a preventer of severe symptoms, hospitalizations. And you finish it. I'm sorry.
Sure. No, I mean, I think there's been a lot of concern with the Omicron variant and the different mutations that we've seen, but we do predict, and we are still at least from what we're still seeing, that the vaccines will continue to offer that protection against against you getting severely sick, needing oxygen, needing to be admitted to the hospital and dying. And so I think really what I'm most worried about is really our people, our constituents, our communities that are not vaccinated. It is a very dangerous time for people who are not vaccinated. I think that it is critical for them to continue to follow the guidance that protects them, right? Which is to continue to to get vaccinated first of all, to get boosted, and to wear masks. Minimize sort of gatherings again for people who are not vaccinated, and avoid crowded settings. That's really, and again, we all, I think everyone has a different risk tolerance, and I think certainly many people who are vaccinated do not want to get infected with COVID, even if it means that even if they might just get a cold, right? And so I think that we all have to sort of layer our precautions with what we feel most comfortable with. And I think that again, we do see the Omicron variant spreading quite quickly, and so that's what's tricky right now is that we're in the midst of a lot of uncertainty, and it's a time where we've been through 2 years of this. Many people understandably want to see their loved ones. I think it's hard to really keep pausing our lives for so long, which is why it's so important that the light out of this is to get vaccinated and to get boosted.
Thank you, Dr. Sanchez, and the perfect cadence and response that I believe we needed to hear. One thing I'm going to ask you to do, I listened into Dr. B and the mayor's IG live yesterday, or I believe it. No, it was at the presser. And if you could real quick, if you could check with whomever you need to check with there. But I thought I heard her say that the numbers give an indication that within communities of color, the vaccination, the initial or one of the vaccination rates had sort of plateaued. Did I hear something like that? Or are you aware of something like that? And I can, if you don't have the answer now, I can look up the question and come back to you. But if you do, we'll stick with you.
So I think what I do want to highlight is that, and I believe what Dr. B was highlighting is that, especially among our kids, so we track sort of vaccination rates in different age groups to
Okay.
really look at where we as a city need to respond, right? And so what we're seeing is that amongst pediatric vaccinations, even though at least at this point we've seen a high percentage of white kids, white individuals who identify as white get vaccinated, currently less than 15% of Black or Latinx kids have gotten their dose of their pediatric dose. So that's a huge disparity, unlike what we've seen before, and really concerning to us.
Can I ask
Yeah.
Dr. Labre and Dr. James? Sorry, because we need to and so because it's important. We talk about health equity and
Mhm.
so restate the number, the major data point that of all BPS enrolled students that I'm sorry, or of those that got of all BPS students, of those that got vaccinated, less than 15% are Black and brown. Is that what I heard?
So of all sort of this is sort of data that we track at the city. So we look at sort of vaccine doses. This is outside of BPS, but just looking at
Thank you.
vaccine doses. No, of course.
Yep.
You know, less than 15% of Black and Latinx children have gotten vaccinated versus we've seen a much higher percentage of vaccinations amongst our white children. And so it's a huge gap, a huge disparity. Again, underscores how much work we have ahead of us to really address the fears, you know, to gain trust and again, to get our kids vaccinated.
Thank you. Dr. James, I'm going to come in. This is kind of a funny question, so you can get me later for putting this one on you, but I think you would be able to speak to it from a personal perspective. I'm not trying to be funny, but would it be rude to ask family members showing up for a huge family gathering to prove if they have been vaccinated? I'm going to go back to Dr. Sanchez's point, but we need to just soften because what I'm about to say, Jesus. Go ahead, Dr. James.
I mean, I was going to say, it depends on how much you trust your family members. I think having an open conversation, this is like this new thing we have to do now when we like talk to family members or friends, like, are you vaccinated? Or like, can you get tested? And I think we just have to make that be normal. If we want to add the layer of showing proof, I leave that up to you. But I do think we should just have these conversations because you don't want to feel uncomfortable, about like being around someone. To just be like, I am vaccinated, or I just had my negative test. And then you can like have fun, enjoy time with your family.
One question to that point as well, Christmas time, children, cousins, that, crossover. And we've gotten away from this language, Dr. Alabri, but we talked about podding and being with, those that, and so would you discourage right now a mixing of cousins and family and children if they have not been around one another?
So for me or Dr. Alabri?
Dr. James, I was just saying that.
So if everyone is vaccinated that can be vaccinated and then I think that you should feel, I mean, it's not guaranteed, and I defer to Dr. Sanchez, but I think that you should feel okay. It's like if we've done everything we can and nobody has any cold symptoms or symptoms that could be COVID. I think when you're balancing like your mental health from like being with people that you love and your physical health, it's like if you've done everything you can to protect yourself by being vaccinated, ensuring that nobody has symptoms, I think that seems safe.
And if I can go back to my analogies again, I think this is not something that's unlike what we've done for many, many years. Think about if you are in a car with your family members, your nieces, nephews, would you let them go without their seatbelt? We know that's not going to prevent you from getting in a car accident. You can still die, but it's going to reduce the risk of severe injury, getting, ejected out of a car. So we've done this. We do it all the time. If you are watching your, again, nieces and nephews, they are on scooters or a bike, do you ask them to put a helmet on? So like the idea is not that dissimilar to what we've done. It's about doing the best that you can to reduce the risk. If we don't have the option, we don't. But this is available. This is an option, and we know it works. And again, I want to go back to sort of the equity and other concerns and fears that we mentioned earlier, is that we have had the highest level number of Black and brown participants in the study for this vaccine than almost any other studies we've had. I don't have the exact number, unfortunately, but I know the percentage is the highest. So for kids who participated in the study when the vaccine was being tested for doses and safety and efficacy, the report is that we've had more Black and brown kids participating. So we know it's not just like we're giving you something that we have no idea how it's going to work for your kids. We know it has worked. It was tested. And the equity needs to be addressed at all levels. And at least this time, it's being done at the research level to some degree. I'm not saying we're fully there, but it is being done. And so let's also continue and not get left behind. Again, I want to go back to that and also take it because we know it works. And the mitigation effects is significant. I also want to add, I mentioned I was on call this weekend. We talked about hospitalizations and we're running out of beds and whatnot. A lot of people have now heard of the monoclonal antibody infusion that really does help to a great degree, reduces, again, severity and risk for hospitalization and deaths. we're also now at a point where we can't get it for the people who need it because it's an infusion. It takes time to get that. You can't just show up and take a pill and go home. You have to go to a center, get checked in, get set up with the IV, get the infusion, which takes about 20 minutes or so, get monitored before you can go. So there's only so much you can do. There's only so many spots that can be available in one day. So we're now talking about a potentially life-saving treatment that we can't get to the people who need it because the numbers are just too high. So it's not just hospital beds, it's at all levels right now.
Treatment.
And I had to not turn away, I actually did make the referral, but I had an 83-year-old this weekend who needed it, but just there was no spots to get that treatment because everyone was full. It was all backed up. And so this is at all levels. It's for your family members, your grandparents, your children, and everyone.
Dr. Labrie, you took the words right out of my mouth. And so I'm going to get ready to wrap us up. And what I wanted to ask is I'm going to ask Dr. Sanchez to sort of give us the final word from a municipal perspective, a woman of color perspective, just in reference to what we need to do, as a city as we're approaching this holiday. And so, Dr. James, I'm going to ask you if you had the ability to speak to the largest group of black and brown parents of children in the world, what would you say to them in reference to getting their child vaccinated?
I mean, I wish I had the magic words to say, just that this is a way to keep us safe. And I think, like Dr. Alabre has mentioned, it's like, let's not get left behind. We know that this is how we can keep us safe. So let's do this for ourselves and sort of take advantage of the fact that this is available.
Thank you, Dr. James, for that. And Dr. Alabre, same for you. And I'm going to ask you a little bit. And I know there are some indicators and words here, presumed family structures. So I'm just naming and acknowledging that as someone who's part of the LGBTQI plus community. But there within the Black community, there's a keep it 100. Within the Black community, there's this impression, and in other communities, period, but of men, and the father and being the protector and whatnot. What would you say to people that are part of that construct? What is the role of some men may be contemplating back and forth getting their child. The family may leave the decision, with the dad or whatever, if that's your family construct. What would you say specifically to them in reference to the children and then to men of color, period?
I think it's really all about responsibility. Whatever structure you're in, I think it's being responsible to yourself and to the people you may be responsible for, if that's the structure you are in. And the responsibility is, again, I'm going back to the same sort of example I gave earlier, is that you do the best that you can with what is available to you. And this is the best that can be done with what we have. And if we don't do it, it's basically irresponsibility right now. That's really the best I can say.
So whatever your construct is, if it's dual, if it's single, if you have, I love how you frame that. If it's dual, if it's single, if it's traditional, if it's what some may classify as non-traditional, whatever, don't be irresponsible if you're the one being leaned on for making a decision. Dr. Sanchez, I'm sorry, y'all. My mother is in the room and I read this and I just heard her voice. We're talking about children. Her 50-year-old son is here. My mother said, just do it. So this is a parent of the host that believes in her child getting vaccinated. Dr. Sanchez, if you could close us out, I just want to make sure we don't have any more questions. People are starting to respond to, are you vaccinated? It's personal, including some family and friends. Oh, this is a good question, Dr. Sanchez. If you could answer this and then maybe speak to what it is that we would say to the residents of the city of Boston. But Rena is asking, including some family members, what do you say? And this is anecdotal, but what do you say to family members that feel it's a sort of private thing, ain't none of your business? Because I've heard about some of that as well.
I lift up Dr. James' earlier point. I mean, we need to have open, honest conversations with the people that we are gathering with, that we are spending time with. I think that's really the critical piece here. And so, at least on that note, if it's someone that you want to spend time with, I think it's important for everyone to to really be open about that. And, I think I want to lift up Dr. Alabre's points around tools. We're living a very stressful and uncertain time right now. But what's really different than a year ago is that we do have tools that we at our disposal, right, to really be able to protect ourselves, to gather, and to sort of again live our lives. And that's get vaccinated, get boosted, get tested, right? So like, talking about gatherings, and we at the city have been working hard to sort of increase testing access again to our communities that need it most right now. And then, continue to wear a mask in public spaces and around those that are not vaccinated. So again, we have these tools, and that's the difference. And we just really need to use them.
Dr. Sanchez, thank you so much. Dr. James, thank you so much. Dr. Alabre, thank you, because Dr. Alabre is the medical director behind this partnership, and to the team there at Mass General, and to your staff there also, Dr. Sanchez, at the Health Commission as well. I will just say that it is imperative that we consider, and doctors, I believe Dr. Sanchez touched on this a little bit, and I'll end with this. Along with the health, physical health, she mentioned mental health. And on my timeline on social media here of late, there's been a lot of death. Some of it attributed to COVID, some of it suspected. We don't want, along with the symptoms from the physical impact of COVID, to leave a long-lasting sting on a macro level in our community, on top of everything else that we're dealing with in, and what's to come post-pandemic from an equity standpoint. And so I leave you with that today. On behalf of everybody that is a part of the Your Healthy Java partnership, we're going to say happy holidays to you. We will be back on January 4th, and I believe we're talking about the new year, new you, Dr. Alabre.
Yes.
And so that's happening on January 4th. Be wise in spending time with your family this weekend. Have the hard convo if you need to. Take care of yourself, because you're no good to anyone else. And as doctor, I think we're going to close this out. This is going to be our closing tagline going forward. Healthcare matters. Get it where you can. The vaccination is available. Dr. Sanchez, I'll be sure I put up the latest. If you can make sure I get it from John or someone there, the latest, whatever graphics or whatever information needs to go on my webpage, I'll make sure it gets on there. Healthcare matters, everyone. Get it where you can. The vaccination matters, and it helps. Get it now where you can. Thank you all for tuning in today. We will see you tomorrow morning at 9 a.m. here for another episode of Java with Jimmy. Thank you all so much.
Bye, everyone.
Bye, everyone.